Hello, everyone. We're ready for a live with CCO. This is number 44. We are going to talk about pharmacology today. Why are we going to talk about pharmacology? Because it's so important to the coder. Whether you're a coder, an auditor, it doesn't matter what area you are in. If you're going to be abstracting information, then a really thorough knowledge of pharmacology is essential. That's why we offer a course in pharmacology. So how does pharmacology help the medical coder? Well, there is several ways that it does. And I have to tell you, I had 5 years of working uh, in a drugstore as a tech, a pharmacy tech. Actually, it was before pharmacy tech became a thing. It was right there at the cusp when you didn't have to be a tech, have a tech license to do that. That the knowledge that I got spending behind the counter and working with those medications really played a big part of me becoming a better test taker, as well as having a more thorough knowledge of the disease process and being able to look at medications and already know what was going on with the patient. It's really, really important that you have a good foundation. Now, our pharmacology course is excellent. It's based on coders, whereas a lot of times when you go in and you take a class in whatever type of pharmacology, it's based on clinicians and clinical work. So that's another reason why I really like the course that we offer. But why do we offer it? Well, because if you're going to get the CCS, you need really thorough. They tell you have to have a pharmacology course under your belt. Medical terminology, pharmacology, and then third, probably compliance. But pharmacology is at the top. Well, medical terminology and then pharmacology, those top two things that you need to be able to uh, be a better test taker, as well as be faster and more accurate just in your daily coding. Why? A look at a medication list for the patient right away tells you about the disease process, and you can see if certain things are active versus they are a history of based on medications. I'm going to show you one of those. Testing purposes. You can rule out sometimes a disease process or ICD codes based on medication. Now, if you are in risk adjustment, it's a must to have that knowledge, because it's usually that area where you find the meat for the disease or the diagnoses that you're linking for that patient, the HCCs. With risk adjustment, you have to have meat showing that a diagnosis is being monitored, evaluated, assessed, or treated. Having a person on insulin right there tells you that the patient has diabetes. If you really want, I tell providers, if you really want to see your coder's head explode in risk adjustment, then state that your patient has diabetes, but give no meat. Don't say anything except the patient has diabetes. And you think, how does that even happen? It does. It happens all the time. So again, if risk adjustment is something that you're thinking about getting into, it's extremely hot, then you want to make sure that you have a really thorough knowledge of medication. Let's talk about a few medications now and why they're important. One that I've seen pop up a lot lately is Lupron. And for the most part, it's used for a lot of hormonal things in glands. So again, uterine fibroids, endometriosis, and things. But prostate cancer is the key. That's what I'm seeing in people's charts. And why is it important? If your male patient is on Lupron, then they have active prostate cancer versus a history of. And what do we see in documentation? Often we see the provider state, patient has a history of hypertension, hyperlipidemia, COPD, and prostate cancer. Well, for us, And as far as the cold set is concerned, it defines a history of as no active treatment. They do not have it anymore. It's been eradicated. It's in the past. But that's not how providers are taught to document. They're giving a list of everything that they are going to talk about in that encounter. So we don't want our hands tied. We can look and see the patients on Lupron, well, they have active prostate cancer because you don't take it without that. And a lot of times, especially with more advanced aged men, we'll see that they put them on a medication like Lupron, and or they have a watch and wait scenario. You know, if you're 85 years old and you have prostate cancer, which is C61, the code, then again, what's the chances that it'll benefit you to have surgery or chemotherapy? You know, probably not. And the talk that you hear from providers a lot of times, if you live long enough and you're a male, you're going to get prostate cancer because your prostate just does that, right? So again, Lupron, one of the ones that I would write that down. I would commit that one to memory because it is one that you are seeing more and more. Let's talk about another one. This medication really is personal to me because my mother was diagnosed a few years back with HER2 positive breast cancer. And I remember when we saw the surgeon before she went in and had her biopsy, they stated that, you know, what we'd like to see is, you know, most likely we'll have ductal breast cancer. It's very common, easy to treat, protocols all set in place. What we don't want to see, and they list off several things, and the top of that list was HER2 positive, and she was HER2 positive. But then when we saw the oncologist said, you know, 3 years ago, back then, she said 3 years ago, this drug called Herceptin came out, and it was a game changer for HER2 positive cancer. She said it was really not a good thing to have HER2 positive, but prior to that, not a lot of the medications were as effective. And Herceptin came out, and there's another one which I cannot remember the name of it off the top of my head. She said it really made a huge difference, and it did. It changed the protocol and the plan for my mother's treatment. So she had this Herceptin and another medication for 6 months. Then she had the bilateral mastectomies, which was able to do biopsies at that time, or do pathology at that time and see that the tumor was gone, it was eradicated, and so she didn't have to have radiology at that time because of Herceptin. Herceptin is one of those drugs that you should think about putting in your knowledge vault, keep it in the little gray cells. It's very, very common now to use that with HER2 positive breast cancer. So, and it does come in a pill form. I don't know now, it does. When she had it at the time, it did not. So it was one of her chemo drugs. But I think that if you do more research, you see that there is some scenarios where women are able to take this medication orally. Again, if you see Herceptin and you don't know if the patient has active breast cancer, that's a dead giveaway that they do. Your knowledge that the patient has cancer is you know, ding 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 there. So if it's a test question and you see on the med list Herceptin, then you know that this is not going to be a history of cancer. Really exciting. Let's talk about another one that's very common, Synthroid, right? Synthroid or is used for hypothyroidism. Now, this is a very, very common medication. Synthroid levothyroxine is another word that you hear to treat hypothyroidism. And if you see that on the med list, especially if you're doing risk adjustment, man, you've got that golden thread right there. The meat is right there. Again, Synthroid is used daily, and uh, the patient is going to have active hypothyroidism, levothyroxine, and Synthroid. Synthroid is more of a name brand, but levothyroxine is the generic, or some people say Levo-T, but there's other medication. Oid, look for words that end in oid. That being said, let's talk about the different suffixes for medications. When you take a pharmacology course, then you learn these. Now, working in pharmacology, you just memorize them because you see them again and again and again. However, it's just like medical terminology and anatomy. When you learn these, it just becomes second nature, the prefixes and the suffixes. So some of the suffixes I wanted to talk to you about that are very common is thiazide, hydrochlorothiazide, which is abbreviated HCTZ, very, very common old-fashioned water pill or diuretic. Lasix is furosemide. So again, Zide. When you see that, it's usually a diuretic of some type. Now, the name brand, Lasix, of course, is not, or HCTZ, you wouldn't know. But if you see uh, the generic name, then it's a giveaway. So Zides, think water pill. Trill is a hormone, so for progesterone, and the most common one that I've seen here is actually it's not there. The levonorgestrel, I've seen that generic, but anytime you see trill at the end of a medication, that is usually a female hormone medication the patient's taking progesterone. Profen, that's an easy one. Ibuprofen, right? That's an NSAID. NSAIDs are used as anti-inflammatory. Sometimes people can't take NSAIDs because they're taking other medication that would mean that you shouldn't take NSAIDs with, or uh, NSAIDs are very harsh on the stomach lining. So if you've had any type of gastric ulcers, you want to stay away from NSAIDs. So ibuprofen and phenoprofen. Some of those others you won't know as well, but they are NSAIDs. Profen. Let's see, I thought I had another one. Let's look at this med list. This patient has a med list, and let's see if there's any word there that you recognize. Aspirin, of course. We all are very familiar with aspirin, and that would tell us that the patient is they're wanting to thin the blood for some reason. Why are they thinning the blood? Is it because the patient has a heart arrhythmia? Is it because the patient has had a past MI? Is it they've had any type of clotting issues that they're on an aspirin? Maybe they have a family history of heart disease and maybe they're taking an aspirin every day. So again, seeing aspirin in a patient's chart tells you right away there's some type of cardiovascular something going on. Then clopidogrel. How many of you know what clopidogrel is? I'm going to look over and see. Oh, metformin. Kathy says very, very common. Metformin is a dead giveaway too. So uh, uh, while you guys are thinking about clopidogrel, what about furosemide, right? That's a water pill. Now we're looking at the disease process. The patient's on aspirin and they're on furosemide. You often take a water pill or diuretic when you have a heart conditions or CHF. So we have two things, aspirin and furosemide. Yes, Kathy says CHF. Absolutely. Humulin N and Humulin R, definitely diabetes. Whitney says anticoagulant. Is that what clopidogrel is? Whitney, is it an anticoagulant? I I'm not sure. That was one I didn't have memorized. Okay, losartan. Who knows what losartan with hydrochlorothiazide is? Now, we know what hydrochlorothiazide is because I just told you it's HCTZ. Lorstantin is actually a heart medication. I can't remember. I think it's a beta blocker. And that's what you learn about alpha blockers, beta blockers, and stuff in the pharmacology. Plavix. Thank you, Kathy. Yes. So Kathy said that clopidogrel is Plavix. Plavix is used for clotting of the arteries, right? Okay. You see them advertise that all the time. That's why I wasn't getting that. Metoprolol, we already mentioned, and Simvastatin. What's Simvastatin used for? We talked about that as well. It's a statin. It's a statin. So, what do we know by just looking at this disease process? We know we have a diabetic. We know we have a diabetic that has probably CHF or some other cardiovascular disease because uh, they are on a uh, uh, lorstantin with hydrochlorothiazide. They're on two forms of water pill, and we know that they're on Plavix, which is to unclog, keep the arteries going when they have hyperlipidemia, and metoprolol, which is a heart pill. So we have some simvastatin, which is used for thyroid. We have a pretty good idea just looking at this patient's mad list what the disease process is showing. Um, I'm just looking hyperlipidemia. That's right, Kathy. Very good. So you guys are on top of it. You recognize these through the med list. What do we want as our takeaway now? We want to know that we're able, I I thought I had some prefixes here, but I guess I didn't have prefixes. Sorry about that. Uh, uh, we want to know that you have a basis in pharmacology to make yourself better at testing. And this is across the board, any credential, any medical credential, period. MAs, CNAs, your RN, your EMT, your CPC, your CCS, any of your specialty credentials, having that foundation is a necessity to be a better test taker and to be able to practice your credential and have that higher level of knowledge so that you have confidence. We want to be accurate when we're coding and working in medicine, and we want to, it's quality and quantity. We want to have good quality, high accuracy, and then we want to be productive. So we want to be able to do quantity at the same time. And pharmacology will get you there. If you haven't already taken a course, make sure that you take a look at the course that we offer. We have a lot of fun in that course, and it covers, when we went through that and I helped put that together, I was really shocked at some of the things that I thought I knew after my time in working in pharmacology and enjoying it that I didn't realize. So we get in there, we get in the nitty gritty of it, and it's fun. So take some time, look at pharmacology slash course, and let us know if you've already taken our pharmacology course, how beneficial it was to you. All right, guys. Thank you.
Do you need more medical certification and business training? Learn more at www.cco.us.